Hi, this is David Unsworth, English editor of the Pan Am Post. Today we'll be discussing yesterday's vote by the U.S. House of Representatives to repeal Obamacare. We'll examine the key changes provided for in the new bill, known as the American Health Care Act, or Trump Care, why it faced strong opposition from Democrats and even some Republicans, and arguments for and against the bill. Yesterday morning, by a 217 to 213 vote, the U.S. House passed a bill repealing key portions of Obamacare. But it was a very, very tight vote. Intense lobbying on the part of Mike Pence and House Speaker Paul Ryan was enough to put the bill over the top at the very end. It faced opposition from a Republican coalition of moderates and, on the other wing, a more libertarian-minded coalition, and every single House Democrat voted against the bill. So what are the key changes of the AHCA? Perhaps what has been most discussed is the issue of pre-existing conditions. The new bill does allow insurers in some instances to charge potential patients more who have certain pre-existing conditions. At the end of the day, enough moderate Republicans were enticed by a measure to boost funding for health care plans for those with pre-existing conditions. It's something called the Patient and State Stability Fund. And this was a $100 billion funding that was added to the bill by the Republican leadership. Perhaps the other most salient feature is that it removes the rule requiring all Americans to have health coverage, what's known as the individual mandate. It also allows insurers to charge the elderly more than the young. Under Obamacare, the guideline was that the elderly could be charged, in general, a ratio of 3-to-1 more than young people could. Now the elderly can be charged 5 times more than young people can. There are major changes with regard to Medicaid. It converts Medicaid funding to a block grant system for the states, and in general slashes funding for Medicaid and some subsidies. Now, children would still be able to stay on their parents' health plan until age 26. That was a popular feature of the bill. That will not change. With regard to Medicaid, which is currently how many lower-income Americans receive health care, states will now be allowed to add a work requirement. If you're coming from a, say, conservative or libertarian perspective, a question often asked is, well, how many people who are currently receiving taxpayer-funded health care and are not working are capable of working? The main, say, libertarian critique of Obamacare was that it was really a massive redistribution of wealth. It was a massive redistribution of wealth from the young and the wealthy and the healthy to the old, the poor, and the sick. Now, many Democrats and even some Republicans might say, well, that's fair enough. We should be moving towards a situation where health care is viewed as a right, not a privilege. A reasonable enough argument, but that's that's getting down to your basic outlook on what the government is as governed by the Constitution, and what it should be doing. Should it be redistributing wealth? That's a very tough question that political scientists and economists, not to mention American voters, are grappling with on a regular basis. So why did 20 Republicans oppose the AHCA? In general, you could break it down to begin with a block of, say, libertarian-minded, say, Ron Paul-style Republicans who opposed it for reasons of ideological purity. For example, Congressman Walter Jones of North Carolina, who's associated very much so with the Ron Paul wing of the party, said, quote, "It's time to scrap this flawed bill and start over." And he also had serious problems with the way that the Republican leadership rammed it through in a short amount of time. He said, go out across the country, gather people's input, and use an open public process to thoughtfully craft a bill that delivers the relief the American people need. Now, in the same wing of the party, you had Congressman Thomas Massie from Kentucky. Massie was even stronger in his opposition. He said, well, the bill is going to be replacing mandates, subsidies, and penalties with mandates, subsidies, and penalties. And then in late March, he tweeted that he was changing his vote from no to hell no. Now, on the other end of the spectrum, you have more moderate Republicans who really made the difference in passage of the bill. The Republicans actually only passed the bill by one vote. They needed 216 and they got 217. Ileana Ros-Lehtinen, probably the most high-profile Republican to oppose it, argued that it would take away health coverage for her constituents. She noted, I will not support a bill that has the potential to severely harm the health and lives of people in South Florida. The recent addition of further funds to high-risk pools continues to be inadequate and fails to cover those who need it most. If enacted, the older and poorer South Floridians will be worse off and will find it more difficult to obtain quality health care. The Democrats are viewing this as a boost to their electoral chances in 2018. Traditionally, if you look at recent electoral history, the opposition party to the president does make moderate to significant gains in the midterm elections. Obamacare has been unpopular. The vast majority of polls had showed that the American public was very much against Obamacare. It seems to be enjoying something of a resurgence now when you poll the American public. Also, Nancy Pelosi is not particularly popular, but then again, neither party in Congress is particularly popular right now. Congress consistently has the lowest approval ratings of any branch or facet of American government. And on the pop culture end, probably the most significant development was Jimmy Kimmel's monologue about his recently born son, who was born with a congenital heart defect. And Kimmel used his night program to attack the proposed funding cuts for the National Institute of Health and call for universal health care coverage. So if you get down to the nitty-gritty with regard to the debate over the bill, one of the first things that proponents are going to discuss is that it allows for more flexibility in plans. I interviewed Michael Cannon of the Cato Institute, a leading expert on Obamacare, who noted that Obamacare basically obligates all Americans to get coverage that they really don't need or want. I mean, particularly young and healthy people, why would they want to pay large amounts of money, a significant portion of their income, for these gold-plated health care plans? It doesn't make sense. The new plan is fairer, say, for younger and healthier people. Again, a major problem with Obamacare was that Obama claimed repeatedly, his mantra, if you will, was more choice and more competition. But it didn't happen. That was demonstrably false. There was not more choice, there was not more competition. There was, in fact, less choice and less competition, which is further bolstered when Senators Bernie Sanders and Ted Cruz had a public televised debate about this a few months ago. They both agreed that one of the biggest problems is that private health insurance profits have skyrocketed. If I'm not mistaken, during the time period of Obamacare, they've more than doubled, from $7 billion to $15 billion. I mean, this is something that should be at the very center of the debate. Coming from a libertarian perspective as I do, it seems that Obamacare is more of this classic smoke and mirrors government tactic. For example, under Obamacare, 85% of enrollees received quote-unquote help paying for coverage. Well, fair enough, but we've got to understand there's either two ways to finance this, either from the U.S. taxpayers or deficit spending, and Obama did a lot of both. During his tenure as president, he raised our national debt from $9 trillion to $19 trillion, more than doubling our national debt. And fundamentally, the U.S. taxpayers send money to Washington, and then Washington turns around and redistributes those funds as government benefits in the form of health care. I mean, there's a great cartoon where Bernie Sanders is snapping a selfie with this young millennial voter. And the millennial voter says to Bernie, you know, I love your plans for all this free stuff. How are you going to pay for it, though? And Bernie Sanders is reaching for the guy's wallet out of his back pocket. I mean, when 85% of Americans are getting quote-unquote help paying for health care, I mean, this is not rocket science here. I mean, they're paying taxes to Washington, and Washington is subsidizing their health care. It seems what would be ideal is to improve the economy and have people pay for their own health care. Obviously, there are going to be people, the elderly, children, the working class, and the poor who can't afford to pay for their health care, and obviously public policy needs to come up with a solution for that. But Obamacare did not appear to be the panacea that it was claimed to be. It's also ironic that Obama was adored by the millennials, the 18 to 30-year-old crowd, but his signature accomplishment, the Affordable Care Act, was actually highway robbery for the young. I mean, by obligating the young to subsidize health care for the elderly, a major transfer of wealth from the young to the old. That's indisputable. And it's somewhat ironic that Trump, who fared poorly with that crowd that did so well, that Obama did so well with, is basically shifting more of the burden onto the elderly and shifting it away from the young. So advocates of individual liberty, people coming from a libertarian perspective, are going to say that, well, that's fair. The young and healthy people should pay less because they're not going to be using the resources of an already overburdened healthcare system. The fundamental message of libertarianism is that the government should do less, and in the United States specifically, it should do what is specified in the Constitution. Now, people with a broader, say more progressive interpretation of the Constitution, the Constitution is a living and breathing document, it evolves with the will of the American people and with the development of our history. Well, fair enough, but people who say, for example, well, the Constitution discusses promoting the general welfare of the American people. Well, does that really mean that the founders and the framers would have supported universal government-funded health care? It seems rather doubtful. And a libertarian is always going to say the private sector and private charity is going to be more efficient and more effective in providing any good or service, as opposed to government-run or government-mandated healthcare plans. For example, Bernie Sanders, who the basic message of his campaign was, well, Wall Street and the 1% have rigged the economy, and the poor are getting poorer, the rich are getting richer, and we need to, trickle-down economics does not work, and we need to tax Wall Street and the banks and the financial system and the wealthy more, and redistribute those funds to the working class. Well, it's an argument that carries a lot of weight with a lot of people. I certainly don't buy into it. Most Republicans wouldn't. Plenty of Democrats wouldn't. But almost half of the Democratic primary voters, particularly the millennial generation, people say under 35, were seduced by this argument. What I'm going to say, and what most libertarians are going to say, is, well, would you rather raise taxes, raise corporate taxes, raise individual tax rates, give that money to Bernie Sanders and his pals in Washington, or would you rather have someone like Bill Gates, who has a massive fortune, 60 or 70 or 80 billion dollars? Look what Bill Gates has done with his money. He's only leaving a fraction, a small fraction of 1% of his fortune to his children. He's spending the rest on healthcare and education, on global initiatives. Now, problems with the bill. A lot of people, especially, say, economists coming from a right-wing or libertarian perspective, are going to say, well, both bills have significant problems, and it's true. Under the AHCA, the elderly and the sick will be paying more. The Patient and State Stability Fund was a key component in order to appeal to moderate Republicans. It provides $100 billion in funding to help states manage the costs of their most expensive patients. It also provides $15 billion in funding for maternity coverage, mental health coverage, and substance abuse coverage. The new plan offers less Medicaid funding for the states, which is a big problem for states with large uninsured populations and insufficient financial resources. Kentucky, for example, was a case in point. If you're going to trumpet the success of Obamacare, well, Kentucky went from about 21% uninsured to about 8% uninsured. Kentucky is a primarily rural, lower income state. And, you know, the 500-pound elephant in the room here is how many Americans who had health insurance under the previous bill are going to have insurance now. We're talking about something in the vicinity of 14 million to 20 million Americans who are going to lose their coverage. That's a serious problem. But then again, was Obamacare the solution? Fundamentally, neither the ACA nor the AHCA are capable of reining in costs. Big Pharma and big insurance are still overcharging patients, and insurance industry profits have doubled since the advent of Obamacare. The fundamental issue from a libertarian point of view, or at least one of the fundamental issues, is the concept of moral hazard theory. If you're going to posit that 95% of 18 to 65-year-old Americans are capable of working, well, they're also capable of paying for at least some of their health care. Now, when you have someone who's working a minimum wage job and needs a $100,000 open heart surgery, obviously you have a serious problem. But what I'm going to say as a libertarian is that if the government guarantees health care for all citizens, there are two fundamental problems. One, it provides absolutely no incentive for anyone involved in the industry to lower costs. If the government says, well, we're going to step in and cover anyone for anything at any time for any reason, maybe except for something like elective surgery, like plastic surgery, well, that's a serious problem. Why are doctors, nurses, medical equipment providers, hospitals, insurance companies, pharmaceutical companies more than anything, they have no incentive to lower costs? Absolutely none. The other thing is, what incentive do human beings as individuals have to take care of themselves if they know that the government is always going to step in and pay for their health care, or for their dental care, or for their food, or housing, or clothing, or education, or anything else? Now, someone coming from a more liberal perspective is going to say, well, there are many people who it's not their fault. It wasn't a bad lifestyle or bad diet or lack of exercise. They were born with diabetes, or they were born with heart problems or cardiovascular problems, or they got cancer or other serious diseases. It wasn't their fault. it's a very tough issue. It's a very tough issue, and obviously the rest of the developed world does offer health care in one shape or form as a right to its citizens. Now, I'm not in agreement with that, but it's there are certainly good arguments to be made for doing what Canada or the United Kingdom or most of Europe or the Pacific Rim nations do with regard to health care. I'm David Unsworth with the Pan Am Post, and thank you very much for listening.